Nurses want a safer work environment where they can provide the best care, where they're not burning out, where they're able to get the job done for Ontarians, and that's just not the case right now.
It's a numbers game that nurses in Ontario believe can be the difference between life and death. The ratio of how many nurses per patient based on the hospital unit is critical.
Please stand me down!
It's become a rallying cry over the last couple of months while negotiating with hospitals on a new collective agreement. Talks, however, have broken down, and the matter is now going to arbitration in April.
How they're managing workload, how they're managing patient care, the way that they're staffing nursing is not working.
For its part, the Ontario Hospital Association says that staffing decisions need to continually change based on patient care needs, and it doesn't support rigid ratios. Quote, in today's complex and demanding environment, these important decisions require daily flexibility and rely on interprofessional teams, working to their full scope of practice. The Ontario Nurses Association continues to reference ratios that were set out in British Columbia last year, the first province to do so. Standards were set for the number of nurses needed in different scenarios, everything from general medicine to intensive care. Although at this point, nothing has been implemented.
Other jurisdictions have done it. They've put forward pieces of legislations that says you need to negotiate ratios. You need to meet a minimum ratios for the different care units that we find in our different hospitals.
Legislation to try and establish patient-to-nurse ratios was introduced by the NDP last June, but was shot down by the Ford government. A spokesperson for Ontario's Health Minister Sylvia Jones says record investments are being made in the healthcare sector. And, quote, Ontario is proud to be home to the largest healthcare workforce in the country. And for the third year in a row, we have registered a record number of new nurses, adding a total of 50,000, with another 30,000 studying nursing at one of Ontario's colleges or universities. Not enough, says those working on the front lines.
This government has underspent their healthcare budget by billions.
Mark McAllister, City News.